Prime Minister, the Honourable Alan Chastanet, speaking in the House of Assembly on Tuesday, indicated that healthcare remains a top priority for the government. The government, he noted, has invested significant sums of money into the health sector and is working assiduously to get major health institutions on island fully operational.
That is why last year we spent $5.5 million as a government in supporting families in need for healthcare. That is why getting the St Jude's up and running and opening, that we've improved the quality of the facility at the stadium. That is why we're now improving and have improved the facilities in the primary health care services. And that is why we're going to have a massive training program, but more importantly, that we're going to introduce a healthcare insurance, a card in which people now, when they are sick, they can go to the doctor. And the benefit to the state is that we will, for the first time, have a state of health of our country. We will know who has high blood pressure, who's pre-diabetic, and start capturing and addressing those problems before they become crisis. But more importantly, that we'll now have programs to be able to benefit those people. And we have the empirical evidence, Mr. Speaker, to show whether in fact that we're making a dent in our problems.
According to Director of Implementation Nancy Charles, the government is striving to have a structure that will ensure the sustainability and continuity of the OKEU Hospital. A proper governing structure would ensure accountability, transparency and maintenance of the hospital. The ability to fund the hospital, according to the Director of Implementation, also plays a critical role in the government's plans. However, she explained that efforts towards the transition into the OKEU Hospital are continuing.
We are currently working on the National Health Insurance, so the Ministry of Finance together with CDB and World Bank, they've started a project in looking at how we can incorporate, if not a full but a partial National Health Insurance. And with reference to the management structure, the government has been in negotiation with Cayman Health City for a consultancy service to assist us in putting a proper management structure at OKEU. So you have been hearing a lot that we want to privatize the hospital and give Cayman Health City the hospital to run and so forth. None of that is the case. We have asked for, or we are negotiating, a consultancy contract, and by that I mean they will be bringing in professionals and persons because they have the wherewithal and they know how to put in certain structures for hospital management and ensuring continuity. They will be assisting us with our local St. Lucians who would be hired for the job, teach them, train them, so that they can eventually manage the hospital on their own.
As it relates to the St Jude Hospital, Charles explained that there were several issues with the existing structure. The condition did not allow for a proper health facility of international standards, and so the government is taking the necessary steps to improve the facility. Some of the structures, including the kitchen, the emergency unit, the warehouse and administrative center, to name a few, require some rehabilitation work.
I am pleased to say that we have started the process of the new wing of the St. Jude's Hospital. So let me remind you, what is it that is happening at St. Jude's? Some of the existing structure at St. Jude's is not fit for use. So for example, the unit that was dedicated for dialysis, it was an existing unit. There are cracks in the building is unsafe, and so we cannot use that building for dialysis. It means we have to build a new structure to house the dialysis unit. And also the main structure for the operations of the hospital, your operating room, outpatient and so forth. This facility also was not in keeping with the international standards for a hospital, and so we now have to build a new wing for that facility as well. So construction for the new wing of the operating and operational center for St. Jude's Hospital has begun. I can safely say that right now we have begun excavation and we are preparing for the foundation and for the building of the structure.
The government of St. Lucia assures the public that no effort is being spared in ensuring the health facilities on island meet international standards and are fully operational. For the Government Information Service, I am Janelle Norville.